Obamacare premiums skyrocketing, insurance companies bolting, and more than 2 million Americans left scrambling for health coverage. Now the government is proposing 14 new rules to try and fix it all. But Gina, you say forget fixing it, we need to get rid of it.
We need to get rid of it. This is exactly what happens, Dagan, when the government dabbles in the human behavior, the choices we make as consumers in our daily lives. We need to let the free market flow. The problem is that we have someone applying for the job of president who has zero understanding of free market economics. And I think if we taught this more in our schools, economics and civics, more in our schools, perhaps the people could understand that competition really works and that it is the problem when the government meddles in that.
John, you have premium increases in states like Tennessee, Mississippi, Kentucky that are up to 62%. How are these little tweaks going to fix that?
They're not going to fix it, and what we're going to see is very much what you see in Europe. You're going to start seeing a cash medical service, which you're seeing right now in the United States as compared to an insurance medical service. And Gina, you may be right about the economic fallibility of these guys, but politically they were spot on. If you want to get something passed, you give something free to a bunch of people, and then you pass on the cost till later, where you have different administrations have to worry about it. That's what they've done. Try taking something free away from a bunch of people. It's not very easy to do. The costs are coming up. This was only insurance reform. We need major health care reform. We've got to fix it because I don't think we're going to repeal it.
Gary Bay?
Well, I disagree with Gina on one point. Hillary Clinton certainly understands the free market based on the evidence of how much she got paid from Wall Street for some of the speeches she gave. But the point is, in medical care, look, I'm going to say, look, we have a free market. We've proven a free market can work in healthcare. It's in plastic surgery. A couple facts. Since 1992, medical care has gone up. The price of medical care, 118%. Price of physician services, 92%. Inflation rate, 64%. You know what plastic surgery prices have increased during that same time? 30%. It shows that the free market works. If people are able to out there and look at price and service and compare and contrast, they can come up with it. Unfortunately, this government doesn't want it for general health care, and that's a mistake.
And Danielle, higher cost, less choice is what people are getting.
I understand, Dagan. The thing is that we had problems with healthcare long before Obamacare. In 2012, before the main parts of the ACA were put into place, our per capita costs on healthcare spending were 50% higher than the United Kingdom, which has quote-unquote socialized medicine. We have three kinds of systems here. We have a purely government system with the VA. We have the sort of new market-based systems with these with the exchanges, and then we have a sort of a mixture with private healthcare as it relates to people who have jobs and who have their employers pay for it. Problem is we have bankruptcy, and that's an enormous problem. You don't get that elsewhere in Europe.
Jenna's final word.
I'm going to go off Gina's point. It's actually our choices that are playing a role in the rising costs. I mean, our choices to have less children than we had in the past is why there's enough healthy young people to pay into a system. Our choices to eat more and be fatter than we were 30 years ago are why we consume more health care. Our choice to take drugs in lieu of health care choices, choices to our health that we could make to not need those expensive drugs that are paid for by insurance, these are reasons why it goes up every year more than inflation that you can't fix magically whether the government gets out or gets in.
So that's why, and that final word would be, that's why the government's going to wind up telling you what to eat. Thanks, guys. Thanks, Gina. Thanks, Danielle. Good to see both of you ladies. A SpaceX rocket exploding on the launch pad with Facebook's $200 million satellite on it. So why is one of our guys still liking it?